This is Raising Tech, your guide to understanding the role technology plays in your community, where to invest to transform culture, and how to bring your team and residents along the journey. Sponsored by Parasol Alliance, your senior living tech partner. Tune in to explore the latest tech trends, dive into hot topics, and hear from industry experts, community leaders, and innovative vendors shaping the senior living tech landscape. Welcome back to another episode of Raising Tech. I am so excited to be joined here by two industry friends. First and foremost, Benjamin's the Director of Education and Culture for Koelsch Communities. And then my other guest here, no offense, Erez, but Benjamin is like one of my favorite people in the industry. But the next person is Erez Cohen, the co-founder of August Health. And we're going to be doing a deep dive today and a little bit of everything and anything. But gentlemen, thank you for joining me today.
Good to be
So,
here.
So first question, let's start with you, Benjamin. If you could just introduce yourself and share a little bit more about your role at Koelsch Communities.
sure. Yeah. I try to find areas where our team members could have a better experience in their work life, or where we can provide better quality care, or where family members might have a better experience. And so I work on initiatives to constantly be improving the experience of those three groups of people.
I love that. And then Erez, you want to introduce yourself and just share a little bit more about your role at August Health.
Yeah, sure. Yeah, my name is Erez Cohen. I'm one of the founders at August Health. My career in senior living has been basically since the time of August Health, which is about 5 years. Before that, I started a company in a totally different space. It was a mapping technology company that was acquired by Apple. And then I spent about 4 years leading a product and engineering group at Apple, kind of learning and really cutting my teeth on how to build good product. When I left Apple, I was really kind of in this mode where I didn't know what I wanted to do next, and was fortunate kind of in this mode. I was actually at the playground with my young son, pushing him on the swing set. And there was another guy sitting next to me pushing his kid on the swing set. And so I started having conversation with him. Turns out he was a physician who spent his career caring for older adults and really introduced me to the industry that is senior living. That random dad in the playground is now my co-founder at August Health. And so we started going on a roadshow of, what is senior living and how can we build solutions for it. And that has since turned into August Health. And we're happy to be here today with Benjamin as one of our early customers at Koelsch, and with many other communities on the platform as well.
Well, I won't ask who was pushing their kid higher on the swing, but that's so cool. It's such an awesome founding story. The power of playgrounds, right? Just bringing
It's a very San Francisco, founder story. That first of all, the kids made it happen, and that it was just at the neighborhood playground.
That's awesome. I love that. And so, Benjamin, question for you, because I know you oversee education and culture at Koelsch, which is just so important, I think, at communities today. And you had mentioned kind of your role of just making that experience better. And I'm wondering, what makes your culture unique to really want to go out and find these things to improve not only residents, but your staff's quality of work?
Well, Aaron Koelsch and Judy Koelsch, they are the driving force behind our company and our company culture. And they are the second generation that is doing this work within the Koelsch family. So I think that family first culture, that culture of that we're not a big corporation, but we all know the CEO and the CEO knows us. That kind of culture is really important. And he's a big proponent of, we treat all people with dignity and respect. And so when you've got this kind of foundation, it opens the door for wanting to really because we're a 65-year-old company, we're very slow to adopt technology because we have seen over 65 years, there's a lot of trendy things that come and go, and you can waste a ton of time with your staff on adopting things that only last 2 or 3 years. And so because we have 6 decades, almost 7 under our belt, and we've seen things come and things go, we tend to be a little bit more focused on what's actually going to make a difference, which of course, August Health was one of those things.
Yeah. And I imagine you feel very empowered in your role there, Benjamin, because I remember in my startup days, you're one of like the first people to reach out to us exploring like new initiatives and stuff. So kudos to you on that. And I know as with August Health, right? Like I continue to hear about you guys, I feel like all over the place, only good things too. So kudos on that. But I'm wondering, you guys are known for being an innovative healthcare company, and I'm wondering if you could just explain a little bit about August Health's mission and how it serves the senior care industry today.
Sure. Yeah, and before I do that, I comment that, while Benjamin says Kelch is slow to adopt new technologies, Benjamin also reached out to me to find out more about August Health, which is pretty unique in the industry that they're kind of coming to a vendor. And then also I believe Kelch, I'll need to like check this with my implementation team, still holds the record at August Health for the fastest implementation for the number of buildings. And so I think when Kelch does make a decision, they go all in. And it was very clear that, we deployed basically in a matter, a building every other day with Kelch, and we couldn't have done it without Benjamin. So, slow, but then makes a big decision and goes all in.
Love to hear it.
So yeah, August Health. I mean, we call ourselves a mission driven company. Every new employee that we hire, we go over the mission. We just did a company offsite, and the big kind of presentation is, what do we do this year that serve the mission? Our mission is to empower the essential work of caring for our elders. And really, we know that we're not caregivers ourselves. We're not there physically caring for residents. But what we've seen so many times is that the tools that the caregivers are forced to use are often antiquated, hard to use legacy tools that actually just get in the way of caring for residents. And so our mission is, how can we provide the tools to empower the caregivers to do a better job of caring for the residents? And that mission takes many different forms in the products that we have and that we've released. Some of them are in saving time for the caregiver so that they literally have more minutes in the day to focus on a resident. Some of them are identifying a resident that might need extra care. So maybe there's a resident who's slipping through the cracks, that there's during a shift change, something missed. Can our program identify those residents? So there's lots of different avenues by which we do improve the kind of the tooling experience for the staff. Our products range kind of the operations in a building where we have a kind of a move-in platform, but then we are a full EHR and care platform. We are kind of the system of record for care that's happening in a community. And we've recently added kind of products or modules for medications, which is a really big and important part of care at a community, for some family engagement, for billing, and some other assets of the community.
Cool. I love that. And, I know we kind of talked about how that partnership formed. I've even thinking back to my own story of when I learned about August Health. And I think, Benjamin, you were the first person to tell me about them too, of like doing really cool stuff. So you keep your ear to the ground, my friend. And I'm wondering, like, of course you reached out to August Health. You're looking for things to make work easier. But like, what were some of those main goals when you first reached out to August Health and started working with them?
Did something for our team that did not require any training to use. That's my first goal as director of training, is how can we create something where they don't need to be trained because it's so easy to use. So to this day, we still do not have any required training for new nurses and department heads when they come to use, when they're hired and they need to use August Health. There's other training, of course, but as far as August Health goes, there's no required training. Now, there's things I think we could, benefit with efficiencies and people using tools they don't know are there, et cetera. But as far as being able to do your job, anyone can just get in and start using it. And that's huge in our industry. The last solution we had, like, you would have to take webinars to learn how to use it, right? You could just show up and know how to use it. Even me, I'm a pretty techie person. Like, I could not figure out how to use that thing without going to webinars to learn how to use it. So that was number one for me. Was such a great user experience that the team doesn't even need to learn, take a training. Like with iPhone, right? You could take a class on the iPhone. You probably would use it better, but most humans can pick up an iPhone and immediately use it. That's what August Health is like.
I love that.
Those children can use it. My kids can use the iPad, and they haven't gone for any webinars.
Right. That's right.
I love that. Yeah. And I've seen some of these systems from afar, and and I like to consider myself, right, like this tech guy that knows his way around these things. And like, even I'm like, wouldn't even know where to begin with some of this stuff. And, I'm wondering, you know, from your point of view, Benjamin, like how has working with August Health really just improved the care delivery you've been able to give at your communities?
Well, excuse me. Well, number one, it is making our nurses have a simpler experience of charting, doing alert charting where they have to, some falls and they need to be charting on them every so often, being able to make sure that they're giving people the right medications, all those things. And for many of those processes, we were on paper before. And so after 65 years, this is brand new for our team to be able to do this with a keyboard and not have to handwrite everything in and pull out binders from, from the wall, pull all these binders off the shelf. And you stack up 16 binders and you open each binder and you go and you handwrite the charting for the night or charting for the day, right? Or if you're passing medications, you're, marking off each medication with your initial. We've had people walk out after, come to work with us and they walk out because they're like, no way, I'm not doing that anymore, right? So for nurses, you bring it to the 20th century, right? Bring it to the 20th century. For leadership, we're able to finally, after 65 years of being in business, we can see every resident in a moment's notice, right? We can see every resident. We can see what's going on with them quickly. Now, for some other people who already had an EHR system, that may not sound as exciting, right? Because they've already done that. For us, it's a really big deal. I think if I had already had an EHR, what my answer would be more like, hey, wow, the team is actually able to use it. It's really fast, right? It doesn't, our previous system would constantly be saving, constantly be, trying to update. This is so fast. You can just get in and move from screen to screen to screen. And it keeps you going. It keeps you working, right? Also, the way the information is presented is very thoughtfully done. And so even if we had been using a different system, which some of our buildings were, a lot of times the service plans and the way instructions are designed or put forward to the staff are not very clear. Whereas the August Health team has really thought through, what does a resident assistant actually need out of all this information? Can we put that on 1 or 2 pages, right? That they could have and easily see what's going on? Or what do the nurses actually need to see? And they're really doing a good job of surfacing information for us that we might not go and look for. So those are a few of the things. Certainly they've been really working hard on their dashboards to develop dashboards that are extremely timely and give us relevant information. So one of the things I love is their watch list, where they will pull with algorithms the 10 residents, 5 residents, 3 residents in a specific building you really need to pay extra attention to. They have fallen many times. They don't have an assessment done. They've lost weight. It's pulling all these different factors and saying, these people, they really need your attention. So anyway, I could go on, but lots of great things that help our team out.
I love that. And, Aris, next question is to you. Like, one of the things I've noticed with senior living communities like Koelsch, right? Like they have very specific needs. And I'm wondering like how you and August Health go about it to ensure your solutions are tailored to meet these needs and requirements of communities like Koelsch.
Totally. Yes. That is something that I also coming into the industry noticed very quickly, that if you have 10 different senior living companies, there's 15 different ways they want to do things. It really, that kind of realization, that configuration and customization was going to be important. Really something we noticed from day one. One of the things that I like to tell new employees is, we started before we even incorporated August Health. Justin and I were visiting communities and shadowing staff to figure out like, how do they do this process? So if we're talking about our move-in product, we would go and shadow a sales director at 4 different communities to see how the move-in process happened. And by the way, for that exact example, for move-in, there's actually 20 different ways it could happen at one building, depending on the dynamics with the family. Is the resident moving themselves in? Is the resident moving a spouse in? Is a child moving their parent in? Is a child in the same state or in another state? And so even for that one little example of like moving a resident in, there's 30 different permutations of how the movement happens. And then even that, it's like, what order do the documents get filled out for the movement? Do they come with the pulse, or do we have to go get the pulse side? And so when we saw that type of workflow, we started engineering a solution that had kind of the ability to like go down the different routes or different permutations from the very beginning. And so kind of by its core design, our system handles lots of those different permutations. And then we've also realized and grown into multiple states. And so one of the things we also realized is assisted living is regulated at the state level. And so that means every different state, even for one company like Koelsch, which is in multiple states, has to deal with the regulations in many different states, which is a whole, burden on the operator. And so for state level regulations, we've also built in configuration into August Health where we can encode rules at the state level, at the company level, to apply to those different criteria depending on what the operator wants to do. Those rules happen at the company level. So Koelsch can say, here's how we want to do things at our entire brand. Here's how we want to do things at Koelsch buildings in Arizona. And then even here's how we want to do things at Koelsch buildings in this specific building for memory care residents. And we can encode those rules into our platform. And so that was something we realized. We're fortunate. I think we're lucky to realize on day one that, okay, this industry doesn't have kind of one happy path. There are many, many different paths. So we have to kind of build a system from the foundation to handle the configuration that's going to be required.
Yeah, it makes sense. And the thought of all the different state regulations too, right? It's Benjamin, I don't envy you at all for having to have to deal with all that sort of stuff. And this next question's for you, and you've kind of talked about it a little bit, but I'll ask it again, but well, not again, but just asking in a different way. But like, what would you say makes August Health's platform stand out from other senior care technology providers? And if, you could share a feature or tool that you think has been particularly impactful.
Sure. Yeah. Yeah. I mean, I'll go back to what Benjamin was talking about with ease of use and kind of the idea that there's still no formal August Health training for new staff at Health. When we kind of surveyed the landscape 5 years ago, we saw lots of EHRs out there, and we saw effectively that staff would use maybe one portion of those EHRs, but then kind of the rest of care would be delivered in a hodgepodge of different kind of workflows. Often a whiteboard was a really important piece of it was the operating system was on whiteboard with different colored markers with the different workflows, a color for residents who had a fall, a color for the memory care residents, a color for new residents, or we saw paper workflows, lots of different worksheets and forms that needed to get filled out for different scenarios. And so we started visiting communities and basically seeing this, like, hey, why aren't people using the EHRs that they paid for? They're paying lots of good money for these expensive EHRs that tout all these features. And it kept coming down to these systems often weren't built from the start for senior living or hard to use for the staff. And so they require, as Benjamin was saying, webinars and trainings and retrainings. And okay, let me go back to that recording and find how to do this one feature. And so that was really the kind of the ethos that we came in with is, can we build something that doesn't require training, where it's as easy to use as Instagram on your iPhone? And so doing that is much harder than it looks. Doing that for every single staff member at every different level and what their job is a very, very hard problem. And often, we'll get into situations where communities will say, hey, actually, we do it like this. And sometimes we'll actually have to say, well, we see how you're doing it, but here's how, you could do, here's how we actually solve the problem you're trying to approach. Rather than filling out that form, here's kind of a digital workflow that might be better. And so it takes a lot of work and a lot of effort to design systems that just are easy to use. But sweating those details is worth it, because then you can get and work with a customer like us where kind of things just flow. I think, a good example that I'll keep coming back to is our move-in product. But a newer one that we're now just releasing is family payments and invoicing. So this is kind of a new product for us where families will receive, their invoices via August Health. They can pay digitally on the platform. This is something that we saw was really hard actually for the family side. So we'd see communities try to send invoices to families, and then families needed to understand those invoices and pay them. and it was hard to digitally pay. So they wanted to pay via ACH or wanted to pay via credit card. And it was like, okay, go create an account in this other system, go log in here, like figure out how to add your bank information. We're all kind of Web 2.0 savvy, especially kind of the newer families moving in. And so the payments experience for families is one that's as simple as like paying for your Netflix bill. It's kind of on auto pay. You don't need to think about it. You can review the invoice and improve it, but otherwise payments just work for you. So that's something I'm particularly proud of. That's a newer product. We've taken that same ethos and said, well, what can we remove from this to just make it just as easy as possible for families to pay their invoice every month? Obviously, that's something that's really good for the communities too, because, they're going to get paid.
Removing friction when people are paying bills is always something as a business owner, it's something you're always trying to look to do. And it's funny hearing this conversation because my next question for you, Benjamin, was to ask about staff training and how that's changed. But it sounds like with the platform now, I mean, that's kind of been removed. And I imagine on the onboarding process for new staff or staff that were on when you started implementing August Health, it's really just changed that. Can you speak, I guess, from your staff's perspective of like what the feedback has been in using this platform?
Oh, in general, I mean, it's very positive, right? I'm thinking of one of our longtime nurses who was very reticent. She'd worked with us 30 years and she saw this coming. She was like, oh boy, this is going to be tough. Right? She was not happy about it. But now, it's changed her life, right? Once it's in your hand and you're using it every day, you realize, oh, wow, I can be so much more efficient and keep people safe. So generally, that is the feedback we hear is this is so much easier to use. It gives me freedom, I think, over head nurses where some of them can, if they're at home, it's the weekend, emergency happens, they can give so many instructions and deal with what's going on by just pulling up their iPhone, their iPad and logging in, seeing what's going on and call a nurse and be like, okay, here's what I need you to do. Right. I mean, before that was impossible. You'd have to drive into the building or be on the phone and asking them to give you information. So even making it possible just to have a work-life balance is also part of the power of this tool.
I'll just to interject with a quick anecdote here. One of our very early customers, this was like, I don't know, probably 3 years ago. He was the owner of, I think, a handful of communities, 2 or 3. So he was just kind of family-run business. He owned 3 buildings, and we implemented with him, and he was a big fan. And about 6 months later, he wrote the team a really, really nice email, and he basically said, "I'm going on vacation next week, and I haven't taken a vacation in 5 years because I haven't been comfortable leaving my residence. And now, like, I feel like I have everything at my fingertips, and if something goes wrong, I can still deal with it on vacation. So I'm going on vacation. I just wanted to let you know." And we sent it obviously to our whole team, and we're really proud of that moment. That kind of work-life balance that Benjamin was talking about, really just, hit home for this guy.
Yeah, and it's in an industry where work-life balance is tough, right? Especially on the operator side, where I feel like you guys should almost change your tagline to like help making vacations happen, right? Almost
For a while we were thinking, the Corona ads were like, it's like the beach, and just like the lapping of the water. And we were like, okay, we'll just do that. And we'll write August Health at the top.
That's so funny. I love that. And Benjamin, my next question's for you. You're modest, I would say, in terms of saying how you guys are slow to embrace technology and really embrace that. But it seems to be really part of the ethos of your culture. And I'm wondering like what you would say to other senior living providers that have been historically hesitant to adopt new technology.
Oh, first of all, don't just pick the product you want. You need to pick the team you want to work with. You can have the best product on the planet, but if the team is hard to work with, the team doesn't get back to you, the team is slow to make changes or accept feedback, it's not going to work. And I think August Health is a stellar example of both a great product and a fantastic team that works hand in hand with you as basically extensions of your organization, right? They are, hand in hand with us as changes come, policies changes, regulations change, as needs change, right? They are right there developing and tweaking their product and working with us and helping our users out. I love their chat feature where our team can just chat with them any time during the workday to be able to ask questions. Hey, I don't know how to do this, right? And it's huge just to have that immediate quick response for our teams. So number one, I think, is you have to find a great team to work with. If you don't, it's so hard to roll out technology. I've tried technology implementations before that were great tools, but the team just doesn't know how to implement, doesn't know how to be a great support, and it just never takes off. It never takes off. You end up wasting a ton of money, and it crosses a lot of pain. So pick the right team. Two, I think it's critical to have a champion within the organization who knows all the players, and you can assign implementation, project management to that person, someone who is able to follow up with every different layer of team members, and help them connect to the implementation team of the technology partner. If the technology partner is just asked, say, hey, can you just go make this happen? That probably not going to work too well. You really need someone within the organization who knows the players, politics, and who can help guide that person through just how to get hold of people. People won't read their emails, people won't respond. And so having that help is critical. I think also, don't be afraid to ask really hard questions when you're selecting your product. You want to ask questions that get all around the issue, right? I'll give you an example, right? As I survey fall prevention software, right? I mean, really hard on these poor guys, right? They're trying so hard to create these products that will solve everything for our industry, but they don't work in our industry. They don't know our industry. They've tried to learn it, but they don't know it. And so I ask them all kinds of questions, right? Like, okay, this is great. You've got a fall prevention software only for their rooms, but 50% of my falls happen outside my rooms. What are you going to do for those, right? You go deep into those questions. Go deep into those questions. Oh, you mean families will have to pay this fee in this way? Let's think about how their experience will be, right? Why can't they just pay that with a credit card or whatever? Like, ask those hard questions when you're talking to someone who's developing a product. Because maybe this month is not the right month. Maybe a year from now, they'll have developed it sufficiently so that it's a great experience for your families and your residents and your team members. Finally, I think, to me, in my first part of my career, everything was focused on the resident experience and resident quality care. But I have come to realize nothing happens unless your team is engaged. Your team likes what's going on. Your team has a stickiness, a gamification, if you will, where they need to be in there. They need to be using this tool. I've rolled out so many great tools that would change the lives of my residents, but because there was no gamification for the staff, they didn't use it. They didn't use it at all. And so tools like August Health, which creates kind of incentives to use the platform, create a stickiness with the team, and teams want to use it, need to use it to do their job, right? That's what's powerful.
Yeah, I think it's a great point, Benjamin, because I definitely have, I think you've been in the industry a little bit longer than me, but when I first joined, it was all about the resident experience too. But if we need to prioritize the staff experience, because if we're having happy, healthy, feel good staff, right, that in turn will pass down to the residents, right, and just provide better experiences there. So it's just such an important call out there. And, the next series of questions, kind of want to look at the future. And Erez, I know you had mentioned like the family payment. I'm wondering if there's any other, exciting developments or advances that we can expect from August Health in the coming years.
The family invoicing and payments is kind of our newest product that we've announced publicly. We are working on something else that's also we're beta testing in a bunch of communities today. We'll probably announce that in the next couple of months, kind of a new feature really focused on how can we take what we've done for most of the staff and bring it all the way to the caregiver, wherever the caregiver is, kind of on the body of the caregiver. And so that's something that we'll be talking about shortly. I would say for 2025, a big focus of ours is really just making sure that August Health is interconnected with the rest of the tools that communities are using. We have great partnerships with lots of other softwares out in there in senior living, and we want to make sure that we continue to build those integrations and interfaces to other systems. From upstream from us, the CRMs are all partners of ours. A kind of data can flow from CRM into August Health that really saves time for the community and really for the resident and their family in filling out paperwork. Because we'll basically just take it, whatever's in the CRM and map it to the movement paperwork. So never even type that information even once. And then downstream from us, as we get more into family billing and payments, accounting integrations are something that we are kind of rapidly working on. But there's also integrations with dining hall systems, with family engagement platforms. We have integrations with BI tools and other analytics providers. And so that's something that we're really focusing on is how can we just make sure August Health is a good partner to the other vendors and that really is for, again, if you think about our mission, that empowers the staff because now there's just one less tool to log into. Data is flowing. That's less typing. That's saving time for the community. That's making sure there's consistent data and it's really empowering the entire community. Another area that, we've already spent a lot of time on kind of our reporting, BI analytics. That's an area that we are doubling down on in 2025. Benjamin mentioned our watch list. That's something we're really proud of. That feature it really does take kind of from a multitude of different factors and try to find residents who might be slipping through the cracks, either at a community level, but also kind of the leadership can also, that data flows up to the leadership. So they can go call a community and say, hey, what's going on with this resident? It looks like I'm seeing all these things. Can you send me an update on the resident? I would say we are just scratching the surface of the data set that we are starting to accumulate. One of the things I'm most proud of at August Health, and I almost say we've earned the right to have all this data, and we've earned the right with hard work of making good design, and as Benjamin called it, gamification to incentivize people to use August Health, and that is incredibly hard. But because we've done that, we have all the data, and we have all the data. Just quick caveat: we don't share the data. The data is owned by the customer. It's Benjamin's data. We have open APIs. A lot of our customers are accessing kind of algorithmically their data whenever they want. And so what we've compiled now, we've digitized a data set that used to be on the whiteboard or in the filing cabinet. And so the watch list was our first foray into, so what can we do with this data set? But I believe that we're just scratching the surface. And so we've actually recently ramped up our data science team with some really strong data science hires. And that's going to be a big kind of area of focus for us in 2025. We've now seen tens of thousands of move-ins to communities and also move-outs from communities. We have a data set to say, hey, is this resident based on all these demographics going to be a good move-in for this community? Also, we have all the move-outs. So we can say, hey, based on all the criteria and the incidents and the medications and the notes that we're seeing, what is the probability that this resident might move out in the next? And can we build models for these things? And this is something I'm really, really bullish on because of the data set we've compiled. And I'll end this question with this. It's only because of the ease of use and the fact that there is no training and all these things that we're able to now do these kind of more advanced, exciting modeling things, which really are my passion. I really come from, I was a math major and a math PhD and so on. And so that's what I want to do. But it took us 5 years to get here. It took us 5 years of building good UI, of shadowing medtech. Now we have the data set. And so we can do these really, really impactful things and really improve the quality of life for the staff and for the resident because now we have this. And so that's an area we can see here in the passion of my voice that I'm very, very excited about. And I believe there's a lot of impact going to happen in the coming years.
I'm ready to get August Health, and I don't even could use it yet, but no, I could ready to run through a wall after that. That was great. And I think to your point about the integrations, right? I think what I see, one of the biggest issues in our industry is just that, right? People think they've got the greatest solution, might not want to play nice. I remember I was speaking to a provider group and someone raised their hand and said they had 13 different apps on their phone and nothing talked to each other in order to do their job. And I almost cried with them. And the way that you're taking it, able to get that data set and I definitely was not a math PhD. I think anybody who knows that knows me, but I would love to see what that entails and kind of what the observations and conclusions you come out of that, because you can tell so much, especially with the way the world's going now. And then my last question, and I'll ask it to both of you, but I'll start with you as to give Benjamin the final answer here, so he can mic drop it for us. But if there's one thing you want our listeners to take away from the importance of culture and technology and senior care, what would it be?
I think we just, one of the things that we want to do at August Health is make sure we're hitting our mission. We started this by referencing the mission, which is how do we empower the essential work of caring for our elders? And so again, and throughout this hour, we focus on the staff and how we make the staff experience better. 'Cause kind of, we believe that the resident experience will be better if the staff experience is better. And so I'll actually just leave you with one stat. So to make sure that we're hitting our mission, we do a lot of surveys of our customers and of our users and say, hey, how do you like August Health? What could we improve on? And so on. Our survey we just did actually in December, kind of all kind of new communities that got on August Health. One of the questions I think was really telling, which was actually not, do you like August Health or does August Health help you? It's, do you have higher job satisfaction because of August Health? Like, did the Koelsch caregiver feel like they have higher job satisfaction at Koelsch because they have August Health as a tool they get to use? And the people who said it was 8 out of 10 caregivers have higher job satisfaction because of our product. And that's something I am incredibly proud of. And I think is pretty impactful to the industry where turnover is such a big issue for residents and turnover is so costly for the resident when the faces that they experience with change. And so that's a stat that I think encapsulates a lot of our work is staff are actually happier in their jobs. So job satisfaction is going up.
Which is so important because, you think about staff retention, right? And like you see every article, I feel like every conference I go to, there's at least a few sessions around that. It's so powerful. And then Mr. Surmi, so same question to you. I'm going to dub you like the technology culture guru in senior living. I know you'll never accept that title, but same question to you. Like, if there's one thing you want listeners to take away about the importance of culture and technology in our industry, what would it be?
Technology choices are not just about technology. They're about providing the tools that team members need to do their job. Technology could be a hammer. It could be a syringe, right? And we always need to make sure our team members have the tools they need to do their job. So don't stop with a great EHR. Also make sure they have enough toilet paper available to them at midnight. Make sure they have enough, bed pads, that they're not having to hide them in the ceiling, right? Our industry is terrible at not giving people the tools to do their job. And so when you are looking at how to create a great culture, one of the number one things you need to do is make sure your team members have all the tools they need to do their job, that they're not hunting around, pecking and fighting for tools to do their job, that they have the tools they need at their fingertips. And so, designing those tools to be user-friendly is really important, but also just making sure that they have the tools they need to do their job is critical.
I love that. Well, gentlemen, thank you for joining me today to do this deep dive on innovation, tech culture, August Health, Koelsch communities. You are definitely two pioneers that are helping to push the industry forward, and grateful two of you have aligned your passions and your careers in this industry. So thank you.
Having us.
Thank you so much. This was awesome. Thanks, Benjamin.
You can find us online at raisingtechpodcast.com, where you can see all of our episodes and contact us to provide feedback or submit an episode idea. We are on social media everywhere at Raising Tech Podcast. If you enjoy Raising Tech, please leave us a review and share with a friend. Music is an original production by Tim Riesig, one of our very own Parasol Alliance employees. As always, thank you for listening.